it seems as though there's a level of efficacy that's worthwhile exploring for Alzheimer's disease. Would you share your experience with that and your understanding of that, please?
Yes, this is very important question, and we're still studying that. You may know that we published again double-blind controlled clinical trial of plasmapheresis in Alzheimer's disease. It was published, unfortunately, it was published in the middle of the pandemic, so the attention that it should have been getting, it didn't. It didn't get much attention because the pandemic got all the attention of everybody. So,
Yeah.
but we have very good results. We stopped the progression of the disease in patients with relatively severe disease, and this was the idea of the whole thing: is to stop the progression of the disease. We were able to do that in 61% of the patients who were enrolled. And in the milder patients, we saw actually improvement in the majority of them in cognitive function, speed of speech, and overall behavior. We didn't see much improvement in psychological parameters.
Can you share, when you say psychological parameters, can you share what that means?
Well, we follow different things basically from the family members, and these patients, for obvious reasons, have anxiety, depression, suicidal thoughts.
Oh, okay, I got you, mate. Yeah.
This didn't change much.
But still,
since then, we have been treating patients on the regular schedule that was recommended in the clinical trial. We have a number of patients in my office. They're actually doing very well. And in Barcelona, the physician who started this whole thing are treating a very large number. They have a whole center with many machines and all that. They're treating hundreds of patients, and they see the same results. So the overall experience is very good. And again, it's much more benign, the monoclonal antibodies that emerged unnecessarily, actually. Lately. They have serious side effects with edema of the brain, sometimes death. Our treatment is very well tolerated, and certainly still expensive, but less expensive than the monoclonal antibodies.
Yeah, well, what you said is actually incredible. 61% stopped, I guess you would say, the downward slide into further into Alzheimer's. Is there any idea of the mechanism? Am I correct in saying Alzheimer's affects 10% of the population over the age of 65? What's the latest statistics on that?
Yes, just about right. And it's growing.
Yeah.
For a variety of reasons, but the population is getting older. So that's one of the reasons. And Alzheimer's is the most prominently associated disease with aging. Diseases like cardiovascular disease, many chronic inflammatory diseases are associated with aging, but Alzheimer's is certainly on the top of the list.
And then maybe when you say chronic inflammatory diseases, is there a hypothesis, or is it proven that as a result of therapeutic plasma exchange, plasmapheresis, that the process, we're decreasing the inflammatory agents, so there's a dilution effect which can lead to the benefits that you're discussing?
Exactly. Irina Comboy has named it dilution, and we've published that with these words, the dilution effect. I think that there is a dilution effect, but there is more to this than the dilution effect. And the Convoys experiments, as well as ours as of late, show that plasmapheresis does much more than that. And surprisingly, for some people, it is not only the removal of substances. So it's not only the dilution effect, but there are substances that are upregulated. So it's substances that are downregulated, but at the same time, there are proteins that are upregulated. So it's a very complex mechanism of action that is poorly understood. And I think the convoys first started to throw light into this process, and our study certainly confirmed what they originally did, and then we found more elements along these lines.
So just for saying, if we look at the effects of aging as a chronic disease, what you said previously, there's massive economical costs for countries, essentially for economies. So my mind actually went to the cost not only to the family of a loved one experiencing Alzheimer's disease, but then also the cost if you don't have adequate insurance, and a lot of people don't have the resources to have a great insurance to be able to support them. Is Therapeutic Plasma Exchange covered by insurance? Is there a chance that it will be soon? If it's not, it seems to make sense. Prevention is better than cure. And I imagine from an economical model as well, if we could prevent Alzheimer's, you'd be saving the economy, the healthcare of countries, which is crippling a lot of countries at the moment. And with the inversion of the demographic pyramid, as more people get older and there's less people simplified paying tax to be able to support people drawing on the economy. Is this covered by insurance? Is it in the process?
This is a very important question and a very important topic for discussion. I will shed some light. Unfortunately, I don't have much light to shed here, but plasmapheresis is approved. I'm speaking for the United States and for some countries in Europe that I'm familiar with. So I don't know the situation in Australia, although I do think that it's approved for certain diseases. The American Society for Apheresis publishes every 3 years recommendations for the treatment of the different diseases with plasma exchange. The last issue was 2023, last year, and Alzheimer's disease was included in the different categories. So for the most part, what is approved by the insurance companies are relatively rare diseases that are treated in a hospital setting. There are a few exceptions, but aging is certainly not one of them. And I think that you're absolutely right. If we continue with the growth of the number of aging people, the need for medical interventions, financially the whole thing is going to be unsustainable. And we have published along these lines. Now we're making efforts with this has to be done. People don't understand that, but the only way we can make any advancement along these lines will be with controlled clinical trials. There's no other way. Unfortunately, in the anti-aging medicine, there is a lot of cacophony of different things that are unproven, and nobody knows anything about them, and there is a lot of mythology, and this does not advance anything, this slows the process. This is why we have taken this path of controlled clinical trials. We did that in Alzheimer's disease. We did that in the anti-aging field, and we will continue to do that. And I hope that other people join us in this adventure, because we cannot convince the insurance companies or any government without palpable data in humans. There's a lot of different mice studies, rat studies, and all that. And if you've seen any of my presentations, I say you're not a rat, because what happens in rats stays in rats. You can't do parabiosis in humans. So I think that we are planning to approach the authorities with our results and ask them what they want to see, because there is lack of attention to preventive medicine. And if we look at this seriously, it is preventive medicine, because all diseases, and I shouldn't say all, but the majority of the diseases that affect older people are have something underlying, and that is chronic inflammation. These are all chronic inflammatory diseases, cardiovascular diseases, diabetes, Alzheimer's disease, and so on. So if we can stop the chronic inflammation, we can prevent the progression of these diseases, and these are the diseases that will require treatment for life, and they will require hospitalization, a lot of money, and put people in wheelchairs before it's time. They may live longer, but they are not going to live life that they enjoy.
And if we're talking about mathematics, they won't be able to stay in the contributing column working for 3 to 5 years extra to pay more taxes to support the economy as well.
Absolutely. Very, very true. Yes.